Welcome back to Great Day. Our next guest says healing the body starts in the mouth. Dr. Samuel Collins, known as the Cowboy Dentist from Manvel Dental and Implant Center, takes a holistic approach that's changing lives. He's joined by two of his patients, Hazel Lundy, who regained her confidence with a new smile, and Rhonda Hudson, who restored her smile after years of pain and surgeries. Together, they prove the mouth is so much more than the teeth,
yes,
right?
Yes.
You're known as the Cowboy Dentist. A lot of it is about your approach. You're kind of like a maverick, right?
I am.
So over 30 years of experience in holistic dentistry is where the area you sit in. Explain what that means to people.
So I'm at the end of the year, I'll be a naturopath, right? So what that means is I'm looking for the root cause. Why do you have these issues? Why do you have
whatever that issue might be? Here's the thing: you can fix the issue, and the problem keeps coming back.
Absolutely,
so if you don't know the root cause,
well, one of the main things is you got to realize, I love medicine is amazing, acute.
Yeah.
If I break my hand, fix it, right? But we know that chronically, there could be some issues with that, right? I mean, are we supposed to take medicine for the rest of our life, right? So at the end of the day, what I'm looking for is that a lot of times we miss the mouth. We don't see the chronic infection in the mouth. Dentists, we are not taught how to look at x-rays and to see if a patient has issues with chronic infection. And
which spreads throughout the rest of the body.
Which spreads out throughout the body.
There's a book that you have read called Hidden Epidemics.
Yes. You know what's crazy? I went to Jersey about 2 weeks ago because I'm doing my naturopath. Mm-hmm. And I'm also an airway mouth doctor, right? So I treat the airway and also sleep. So my airway guy told me 6 months ago, hey man, I need you to read this book. So I read it. So when I went to my program in New York, I go downstairs and the lecturer is the guy who wrote the book.
Wow.
It was so amazing.
Meant to be. Yes. Yeah. Your motto is your body is a battery. If you have infection in your mouth, you're losing power everywhere else. So when you look at what's happening in somebody's mouth, it's about more than that immediate area, as you mentioned. You like to detoxify chronic infections. It can reduce medication use, treat the root canal failures, cavitations, jaw infections, and airway issues. And as we know, when you have that infection in the mouth, it can affect so many other parts of the body. They'll say heart disease, right? A lot of heart disease.
Well, we know that, right? Yeah. Everyone's told if you don't clean your teeth, you'll get heart disease, right? But listen, the biggest problem is most things in dentistry is asymptomatic.
Yeah.
It could be a tooth that was extracted 30 years ago, but maybe I didn't remove all the infection. Maybe I didn't remove the fibers around the tooth. It's like me impregnate or taking your child out and leaving the womb inside of you, right? Maybe the root canal, because the problem is, if you're gonna do a root canal, you probably need to go to a specialist who has microscopes and they can see all the things that's going on.
You look at everything that's around that as well.
Look at all that stuff.
Sounds a little bit like Hazel. So Hazel, you were always known for your beautiful smile, and you thought you were always doing everything right. You brush your teeth every day with peroxide on top of that. You had fluoride in the water, and you always kept up with your dental appointments, which a lot of us are guilty of. We always show up when we're in pain and when something's wrong, right? But you did all that, but at 74, something started happening.
Yes, my teeth started falling out for no reason, no blood, no pain, just falling out. And so when the front one fell out, I was going to work with a mask on. So when the front one fell out, I knew it was time to do something.
Yeah. How did that impact your self-esteem?
Oh my God, everybody who knows me know I'm in politics, I'm in my community, I'm very social. My smile was always my trademark. Yeah. And so I was starting to get a little depressed and a little sad. I visited several dentists in the area who didn't give me the feeling that I could afford to do this.
Yeah.
And one day at lunch in the parking lot of my car, I heard the Cowboy Dentist. And I was in Rosenberg, and they said, we're taking new patients. He was in Rosenberg. I called and immediately got an appointment. And I went to visit him. His staff was excellent. And before I walked out, they said, we have good news for you. And I said, what's that? And they said, we got your financial ready. I'm like, really? No doctor had gone that far.
Yeah, because it costs to get your teeth back. I mean, to get teeth again. And what you get in return is priceless. But you came out of retirement, you went back to work, and you have you had a tooth fund.
Yes, that's my.
You became your own tooth fairy.
This good doctor right here.
Yeah. So you went ahead and you went in. Now, the thing to me is the shock of when your teeth start falling out.
Oh, right.
We always say we'll outlive our teeth in some other parts of our body, but
Right.
with this, you had felt, like you said, dismissed by several other people. I would imagine that other offices sometimes will say, well, you're 74.
Yes, exactly.
It's just going to happen at 74.
Exactly. And that was the other thing. My age, people, and Dr. Collins told me, said, you don't know how long you're going to live. You know, your quality of life. And that made a big difference because everybody was saying, girl, you're 74 years old. You don't, get you some dentures and go on.
Yeah, my mom got her implants at 93. She's
Oh,
like,
wow.
I want to eat until my last meal,
Thank
right?
you.
And eat what I want.
Right.
All right, so
Perfect.
what was the treatment that you did for her?
Well, this pretty lady was a little different. She wanted up top. She wanted all on X, which means I'm putting extracting teeth, putting multiple implants in, and then she wanted to do a snap-on denture on the bottom, which means I'm putting implants in, but the denture is snapping in place.
All right, so let me just say this. What it means is it's not a one-size-fits-all, and you talk with the patients and say, what are you wanting? And then you suggest what you think is better professionally. And so now you're smiling for us. Smile for us. Yeah, there you go. All right, Rhonda, you were in a car accident at 16. You had metal plates in your face, corroding plates made the bones brittle. All types of things were causing like a domino effect in your mouth.
Yes, so every doctor I'd go to would blame the car wreck or blame something else, and then they would medicate me. So every medication, every pain medication they gave me on top of it, my bones would be brittle, and then my teeth would start breaking. And as soon as they would break, you would get an infection. I mean, and I would stay sick, and finally I used to sing with my son, and I stopped. I wouldn't leave the house.
Too painful to do that even,
Oh,
right?
yes, I stayed in my room almost 3 years. I mean, I went from couldn't shut up to I wasn't going to say a thing.
Yeah. And so when it comes to even basic things like you have to eat, but every bite risked breaking another tooth and was painful.
Oh, very much so.
Then you also felt very judged by your appearance. And I would imagine too, when you do eat, a lot of soft foods are involved, which could be like potatoes and soft carbs and pastas. And what happens then is you gain weight because
Lots of weight.
Yeah.
I was pushing over 400 pounds, and I couldn't imagine what am I doing to get this much weight put on. And I was on Facebook, and I had seen a comment on a like a rodeo website, and I was just looking for a time, and I saw somebody had put down about the Cowboy Dentist, and I thought, that's right up that's up our alley. And Manvel was only 20 minutes from my house, and I went, and it wasn't
Wow.
Everything
there changed with you.
Oh, yes.
Everything. You said people used to think when you said you had grandkids, they would say, "Oh, yeah, of course you do." Now that you say you have grandkids, they go, "Really?"
Yeah.
It changed everything about you.
Oh, it did.
I'm not sure if you can go back to that picture again, but I really want people to see that. Rhonda was taking probably about 20, 30, 40 pictures of pills a day, right?
Oh yeah, I couldn't get the pain to stop, and the doctors kept prescribing it.
Yeah.
And so I told her, I was like, yo, it's your teeth. And when I removed her teeth, immediately she became that woman. In her eye, look at
So the pain. So let me
eyes.
back up a little bit. So they kept saying, okay, well, it's the pain from your teeth, and so therefore let the teeth in. If the teeth were the problem, the infections were the problem, they shouldn't have stayed in. It's basically your point. That should have come out. You remove the teeth, therefore you remove the pain.
No migraines. I don't even think they checked me for fibromyalgia. I think they just said, "Oh, you hurt," and everything hurt. It wasn't just. It was, I couldn't, my ears, my neck, everything.
So they were assigning it to some other illness, mystery illness you may have had, and here's a pain pill.
Right.
And so back again to your point, the source of the problem. You can medicate a symptom, but you got to get to the source of the problem.
I think, listen, I love, medicine is amazing, but we have to start looking at the mouth. And you have to go to a dentist who understands. I'm a biological dentist, so I'm treating those things. You have to go to someone who understands that the mouth is so important. I literally, when I saw her, I walked out and tears came down my eyes because I had to see her on a Saturday. I don't even do Saturdays at all. And literally when I saw her, I was just so pleased because I knew how sick she was. And to see her now.
Yeah, you've lost how much?
I'm almost 390 something pounds.
Basically
so.
400 pounds.
Right.
You lost almost 400 pounds. Your 19-year-old son's a musician and a country and rock singer. No wonder you love the cowboy thing, right? But you can now smile proudly at his concerts. And so you get back to life and quality of life. And I know your family has also noticed it. There's someone who is with us this morning who's gonna come walking on in. This is Mama. Mama, sit on down. What difference did you see in your daughter once they got to the root cause of her pain?
She was like a different person. I mean, she could smile, she could leave the house, and Rhonda was always outgoing as a young person, so it was like giving my daughter back.
Wow. All right. So, Dr. Collins, this is the deal. You know, when you go in, people just have to be not afraid to go in, number one. I think a lot of people are afraid to go in because you've been to so many dentists that maybe it didn't work out, or people sometimes feel ashamed of their teeth. You're like, come in, let's get to the root cause and get you back to life.
You know, God has blessed me to do what I do. I have no idea, well, I do know how. I have no idea why I'm doing this biological stuff, man. But I don't care about how your smile is. Anybody can do that. I want to change your life. I want to change your life.
Yeah.
I want to make
And
sure
they're
you're
both
happy.
nodding their heads right now.
Yeah.
You're tearing up. You're tearing up.
Oh yeah, he knew. But he didn't even have to see the pill ball in my. He knew.
Yeah.
And there was no. I knew what was going to happen. It wasn't like, oh, we're going to do it in a day. This isn't going to take a day. It didn't happen in a day. Work with me, and I'll work with you. And
this is
anything
the
that,
new you
yeah,
that we
and
have.
it's not just him. It's his entire staff. They all care, and they all are aware.
All right. The Cowboy Dentist has a special offer for Great Day Houston viewers. Get a free consultation and CT scan when you make an appointment, and lifetime warranty when you go through the process. They have 2 locations, one in Manvel and the other is in Rosenberg. Worth the travel if you're not close there. You can take advantage of that special offer now by calling 361-D-COWBOY. How about that? That works out to 361-326-9269. 326-9269. You can also visit them online at thecowboydentist.net, thecowboydentist.net.